So let's say 60s, 70s, or even younger than that.
Wow.
So we're not really seeing our family develop all of these complications of a poor lifestyle because they're not living that long anyway. Right. Whereas now in the West, a lot of our parents will be living a lot longer and now suffering from these complications of a poor lifestyle. But it's not until they've now got it that we now think, okay, I need to change. And the thing is, change is good whenever you decide to apply it.
What are the some of the like main complications, health complications that you see within the African and Caribbean community?
So obviously it's difficult to say because like where I'm working now, specifically, let's say urology, which affects everyone. But let's say in urology, let's say prostate cancer tends to affect black men disproportionately to their counterparts. Yeah. And reason. Well, one reason could be because we seek medical intervention a lot later. We don't really know what symptoms to look out for. Because if I asked you what you would think the symptoms of prostate cancer are, you would...
I
don't even know.
I'd say something to do with, I don't know, when you go urine or something.
Yeah. So like your prostate is like a small walnut-sized structure that just sits beneath your bladder. And obviously we're young, so we're not at an age where it's likely to affect us. But in let's say 40s, 50s, 60s, that's when we'll be at risk. And things like going to the toilet, seeing blood in your urine, or going to the toilet and struggling to pass urine. Let's say the stream is weaker. Things like that, people may not feel comfortable going to their GP about.
Totally understandable.
It's kind of, it does seem like it would be embarrassing, sort of, you know what I mean? And I feel like obviously, as that we're grown men, a lot of grown men, you probably don't want to feel like that embarrassment of, this isn't functioning properly or something like that. Do you know what I mean? Because it might make you feel like less of a man, especially when we're probably seem to be like we should be in our prime, basically.
Even amongst each other, like as men, we don't talk to each other about, like symptoms. A lot of the times I think we'll just speak to our mother. Some men don't even have mothers to speak to, so it's like then we turn to Google, and I think Google's the worst thing you can do. If you want to search any problem on Google, my God, that stuff.
Because then what people will do is they'll look at the worst case scenario, and then they'll become like a hypochondriac.
Yeah, I never Google health, symptoms, because that stuff will just scare you.
Yeah,
it's like you end up in a rabbit hole, and then you'll see, even Google, where they will suggest another question related to that.
Yeah.
Then another one.
Exactly.
You know what I mean?